So hello, hi everybody. Today I'm going to tell you step by step how to remove growths, small growths on the skin, be it on the face or on the body. So this is a jet plasma device. As you can see, it is EU approved. So it is the only device, US FDA-approved device in the whole world which is used to remove growths. So as you can see, so this is how it comes in a box, and this is the plasma pen. It works on direct current. Rest all the different pens available in the market, they work on alternate current. So this is how it is different, and as far as the patient is concerned, I think this is one of the best device that should be used to remove growths. One, it is very precise. It doesn't affect the surrounding tissue. There is minimal damage to the skin, and it is very less painful and very safe. So I'll tell you how to fix the pen. So this is the attachment. This is how you fix it, right? And there are two holes that you see, right? In one goes current, and now to complete the circuit, this blue one goes here. So once it's ready, you put it like this. So this pen, this attachment, you fix it here, and then you can stick it on your patient's skin, right? So as you could see, this completes the whole circuit, right? The device is now ready to remove any growth. So you start it from here. So once we'll ready our patient, we'll put a numbing cream, and while the numbing cream does its action, I'll explain to you how it has to work, right? So this is our patient today. So he has a small skin tag here that we're going to remove. So before we start the procedure, I just want to highlight a few very important things. So whenever you are going to begin your treatment, it's very important that your patient is comfortable. You've explained everything to the patient, and then whatever you have to use for that procedure should be very handy and near you. So this is how I set my treatment, all that is required for the treatment. So this is how it is. I have fixed the pen. I just told you how to fix the pen and keep it ready, right? So all the things that are required are here. So there is a cleanser. I have kept some face wipes and swabs, a pair of gloves, the numbing cream. We already applied the numbing cream, and I have removed the numbing cream now since we're going to start the procedure. So I'll just, before I start the procedure, I'm going to take a bit of a sanitizer, sanitize my hands completely. So I usually do not like too much of assistance in the room while I'm doing the treatment. I try to keep everything handy so that I don't have to get up. You know, when you're doing a treatment, so it doesn't look good if you're, moving around, going out, getting things. So always better to organize it properly and then do the procedure. So I put on the gloves. So now, like I told you, so we will take this out and we have to fix it. So we can fix it here. So before we fix, it's very important that side by side you explain to the patient what you're doing. Hi Rajesh, I hope you're not scared.
Yes, I'm a bit.
You are? Okay, don't
No, I'm normal, I'm fine. I'm in the best hands, so perfectly fine. Yeah.
Oh, thank you. So this is just going to be a quick 5 minutes, less than 5 minutes procedure. So I'm going to stick this right on the arm here. This is just to complete the circuit so that we're able to remove. And just be very relaxed. This treatment is going to be almost painless. We already applied the numbing cream, so you don't have to worry. And we are going to do it with one of the best devices available in the world. So just relax and here we go. So since it's not a very big skin tag, it's a very small one, so I have set it at 1, right? So you can increase it from here to go up to almost 8 is the maximum it goes. Now one thing very special about this pen is that you do not have to touch the tip on the skin, right? So even at a distance of 2 millimeter, it is able to remove the growth, right? So here we start. So you can just turn your film, that's it. Yeah, lovely. So we just keep it at a distance. You can see I'm not going too close. So at a 2 millimeter distance, basically it is able to cauterize and remove the growth. So are you comfortable? Are you feeling any pain?
No.
Okay, great. So basically how this works is the current goes and it creates a plasma around the tissue, around the growth that is to be removed, and the heat energy that is transmitted to the skin, it actually causes blackening of the skin. So there are 2 things now that you can do. One is you can just leave it like this and it will get sloughed off in a day or 2. The other thing is using a forceps, you can just scrape it off. It will come off very easily, right? So I'm not going to remove this. I'm just going to leave it like this. Apply a little anesthetic cream, that's all. So there are a few instructions that I'm going to give to my patient. So yes, it's all done. How was it?
Oh, that was very lovely, very smooth. I didn't feel anything.
So there are a few precautions that you have to take. So I'm removing this, fixing it back here. So while you're doing your treatment, it's very important that side by side you organize all the instruments and everything. Okay, so we'll remove this. Here it goes. So yes, Rajiv, so a small scab is formed here. You just take care that you don't scratch it off, right? It might cause a little, maybe, when you take bath, you might feel there is something, but then just try avoiding the scratching you sometimes you feel. It is going to fall off in 2 to 3 days. I'll give you one antiseptic cream that you should apply twice daily. Just take a very small quantity, rub it properly like this, right? So that it gets absorbed, it's not visible as a whitish thing on the surface. And if you feel there is some growth left, like after it falls off, it will take around 3 to 4 days to heal. If after 1 week you rub your hand over the growth and if you feel there's something, you can always come for the follow-up visit. Right?
Okay.
Okay, thank you so much.
Thank you, doctor.